Supporting thyroid function is an absolutely crucial component of managing infertility, and it's often an overlooked component for patients undergoing fertility treatments. And managing thyroid function has a very important role in several parts of the fertility process. It has a role from as early as supporting follicle maturation growth, from supporting ovulatory function, sex hormone production like estrogen and progesterone, potentially impacting things like fertilization, implantation, and even maintaining early pregnancy. So it's really from step one all the way to the final stages in supporting a healthy pregnancy. So thyroid function is an absolutely crucial component. So thyroid function is an absolutely crucial component to supporting optimal fertility treatment outcomes. Now, where the discrepancy can often arise in why patients might not be getting the best management for their thyroid function if they're dealing with infertility is because their thyroid function is often compared to what it should be like for the general population. And now we're seeing more and more research that is suggesting what is considered optimal and ideal thyroid hormone parameters for someone that's dealing with infertility or trying to conceive is very different from someone that's just trying to go about life and not trying to conceive and wants to have a healthy quality of life. So we're seeing two sets of parameters of what would be considered optimal thyroid hormone parameters. So for example, if someone has a TSH of 0.5 to 4.5 in Canada, this is usually considered normal and healthy at a TSH range. And thyroid treatment may not be initiated for someone until their TSH is high as 10, depending on some guidelines. Now, if you're dealing with infertility, a recently published review that looked at over 130 publications on thyroid health and fertility actually suggests that if a TSH is above 4 and a patient is trying to conceive, they should be considered for reducing the TSH below 4 with thyroid hormone replacement therapy. Similarly, if someone has thyroid autoimmunity, where one of the antibodies for the thyroid is actually elevated, we become even more stringent with what an optimal TSH range should be for someone dealing with infertility. If it's between 2.5 to 4 and someone has thyroid autoimmunity, based on these updated recommendations from this new publication, they should also be considered for thyroid hormone replacement therapy. Now, if someone has elevated thyroid autoantibodies, but they have a very normal TSH, the antibodies on their own, there's now research suggesting may, independent of the thyroid hormones, interfere with things like implantation and may be associated with a higher risk of miscarriage. So managing the thyroid autoimmunity component may actually have a very important role in supporting patients that are trying to conceive or have been struggling to conceive. So often patients will struggle to get recognized the thyroid condition they're dealing with their infertility because they're still being compared to what should be used for the general population and not necessarily for reproductive health and supporting reproductive outcomes specifically. So if you are dealing with infertility and you haven't been tested for things like thyroid autoimmunity or your TSH is on a higher end of the scale, like above 4, this is something that should be discussed in much more detail with your healthcare provider, particularly if you have a first-degree family relative that also has a history of thyroid disease. You are, in general, upwards of 6 times more likely to experience thyroid disease if you have a first-degree family relative that also had a thyroid condition, and then evaluating for other risk factors and comorbidities with thyroid disease that may impact your fertility as well, for example, elevated prolactin, among others.